Welcome to the Deep Dive. Today we're diving into all this material you've put together about sustainable health. It's a
Okay.
pretty fascinating mix. We've got podcast excerpts, articles. Looks like there's even a study from Finland.
Yeah, I found that one particularly
Oh,
interesting.
cool. So I guess we'll be exploring what sustainable health really means,
Yeah.
how it connects to our lives, and um, what we can learn from all this, experts, global initiatives,
Sounds good.
just the light stuff.
Yeah, exactly.
So from this initial scan, what jumps out at you?
Well, one thing that really struck me was how the sources emphasize that sustainable health isn't just about, what we eat or how much we exercise. It's
Hmm.
more about
Right.
creating a world where everyone has a real chance at being healthy,
Okay.
both now and in the future.
I see. Yeah.
It's like a bigger picture thing.
Yeah, I'm really interested in this distinction that one of the sources makes between
Oh, yeah.
sustainable and sustained health.
Yeah.
What's your take on that?
I think that's a really important point because
Yeah.
it helps clarify things.
Okay.
Like sustained health. That's more about maintaining your personal well-being over time.
Mm-hmm.
Like you said, diet, exercise, things we do as individuals.
Right.
But sustainable health,
Yeah,
that kind of zooms out and looks at the bigger picture.
I see.
It considers all those external factors like access to clean water, affordable health care,
Mm-hmm.
and just living in a healthy environment,
So it's not just about our individual choices.
Right.
The systems around us have to be working too.
Yeah, exactly. It's a two-way street.
Gotcha.
It takes both individual responsibility and supportive environments
Right.
to really achieve sustainable health. And this idea,
Yeah.
it's been around for a while, actually.
No, really.
Your sources point out, think about Rachel Carson's Silent Spring back in the 60s.
Okay.
That book really highlighted the connection between human health and the environment.
It's amazing how some things just keep coming back around.
I know, right?
Yeah. And, like one of the sources points out, humans are the first species that can actually destroy the environment we depend on.
That's a sobering thought, isn't it?
It really is. Like, makes you rethink that extra plastic bag at the grocery store.
Yeah, definitely makes you pause.
So it sounds like understanding sustainable health is pretty urgent then?
It is. We can't pretend like our well-being and the health of the planet are separate.
Yeah.
They're completely intertwined.
Mm-hmm.
And it's exactly what the World Health Organization is trying to address with those Sustainable Development Goals for 2030,
Okay.
especially the goals focused on health and well-being.
But the sources also mentioned the pandemic kind of threw things off track a bit, didn't it?
Unfortunately, yeah.
Yeah.
We were making some good progress pre-2020, like reducing child mortality and promoting healthier lifestyles.
Mm-hmm.
But the pandemic really exposed how fragile those systems can be.
Right, and how some people are hit way harder than others.
Exactly.
The pandemic was kind of a wake-up call then,
Yeah, I think so.
to invest in global health systems that can handle these kind of shocks
Mm-hmm.
and make sure
Mhm.
everyone benefits.
Absolutely. We need systems that are more resilient and equitable.
That makes sense. Now, the sources really dive into this rise of non-communicable diseases like heart disease, cancer, diabetes.
Yeah, it's becoming a major issue.
What makes them so relevant to sustainable health?
Well, for one thing, these conditions are often linked to lifestyle factors.
Okay.
What we eat, how much we move, stress levels, even things like pollution and access to healthy food.
I see.
It all ties back to that web of sustainable health we were talking about.
Right, it's all connected.
And these chronic conditions put a huge strain on healthcare systems, especially as people are living longer.
That's a good point.
So it's a major challenge.
Yeah, it's kind of frustrating, though, because they're largely preventable, right?
Yeah, that's the hopeful part.
Like, we have the knowledge, but putting it into practice globally?
That's the tricky part.
Yeah.
But one of your sources highlights a story that shows it can be done. A region in Finland called North Karelia.
Okay.
Back in the 1960s, they had the world's highest rate of heart disease.
Wow, really?
Yeah, they were facing a serious crisis.
I see.
So they launched this community-driven program
Okay.
focused on simple lifestyle changes,
Like what?
encouraging people to replace fatty foods with more vegetables and berries,
Mm-hmm.
cutting back on salt and getting more physical activity.
So like a back-to-basics approach.
Yeah, pretty much.
Interesting. Did it work?
It did. They achieved a 45% reduction in heart disease deaths.
Wow. That's incredible.
It just goes to show that even when certain habits are ingrained,
Yeah,
positive change is possible.
that's really inspiring. So what other strategies for action did the sources point to?
Well, one common theme was the importance of strong primary care,
Okay.
especially the relationship between patients and their doctors.
So ensuring people have access to basic health care
Right.
and doctors who really listen to their concerns.
Exactly. It may sound simple, but it's crucial for prevention and early intervention.
Makes sense.
And the sources also stress the importance of protecting vulnerable groups:
Like who?
children, pregnant women, adolescents.
Okay.
They're particularly susceptible to environmental and social factors.
Right. It's about making sure everyone has the same opportunities to be healthy,
Yeah, leveling the playing field.
no matter their age or circumstances.
Exactly.
Makes sense. And I'm guessing there was a lot of emphasis on promoting healthy eating, reducing salt intake, and encouraging physical activity.
Of course. Those are all key factors in preventing those non-communicable diseases.
Right. Just like what worked in Finland.
Mm-hmm.
But the sources also talk about the role of government, right?
Yes, they do. They emphasize the need for government support in things like ensuring clean water and sanitation,
Well,
controlling pollution, and promoting active transportation options.
so like bike lanes, walkable cities, things that make it easier to be healthy.
Exactly. It's about creating environments that support healthy choices.
You can't just tell people to eat healthy if they live in a food desert.
Right, or if it's dangerous to walk around their neighborhood.
Exactly. It's about systems.
It is, and what I found particularly interesting is how the sources connected these broader strategies back to individual empowerment.
I'm curious about that. What do they mean by individual empowerment?
Well, it's about giving people the knowledge and skills to make informed decisions about their own health.
Okay.
They talk about the importance of health literacy and point to the new nutritional pyramid.
Which focuses on lifestyle factors, right?
Yeah.
Not just what you eat, but how you live.
Exactly. And one of the sources mentioned something called blue zones.
Yeah, that caught my eye too.
These are regions with exceptionally long lifespans where lifestyle seems to play a key role.
So like Okinawa, Japan,
Yeah.
where they have those strong social connections and eat mostly plant-based diets.
Exactly. They offer a glimpse into how we can cultivate sustainable health.
It's not just about living longer.
Right.
It's about living better.
It's about adding life to those years, not just years to your life.
I like that. So after this deep dive into sustainable health, what's the main takeaway for our listener?
I think the most important message is that even small changes can make a big difference.
Okay.
We don't have to overhaul our entire lives overnight.
Right.
One of the sources highlighted that just reducing daily salt intake by a single teaspoon
Wow.
could prevent millions of heart attacks globally each year.
That's amazing. So what are some other small steps people can take?
Well, think about some of the things we've been discussing.
Okay.
Start by incorporating more fruits and vegetables into your meals.
Mm-hmm.
Maybe try swapping sugary drinks for water more often.
Okay, what about exercise? That one always seems a bit daunting.
You know, the key is to find something you genuinely enjoy.
Yeah.
And aim for at least 30 minutes on most days of the week.
Right.
It could be walking, dancing, gardening, anything that gets you moving.
Yeah, something you look forward to.
Exactly. And don't underestimate the power of sleep and stress management.
It's so easy to sacrifice sleep when you're busy.
I know, but it makes a huge difference in how you feel.
It really does.
And finding healthy ways to manage stress is essential too.
Absolutely.
Yeah.
But sustainable health goes beyond just us as individuals, right?
Mhm, that's right.
It's also about advocating for policies
Yeah,
that support healthy environments
absolutely.
and ensure everyone has access to health care.
It's about the bigger picture.
So if our listener wants to make a difference,
Mm-hmm.
they can start by making those small changes in their own life
Right.
and then support initiatives that promote sustainable health in their communities and beyond.
Exactly. And remember, knowledge is power.
Mm-hmm.
The more we understand about how our health is connected to the world around us,
Yeah.
the better equipped we are to make choices that benefit both ourselves and the planet.
Well, this deep dive has certainly opened my eyes to how my daily actions contribute to that bigger picture.
That's great to hear.
It's got me thinking about some changes I can make.
It's important to remember that this is a journey, not a destination.
Mm-hmm.
There's always more to learn and new ways to grow.
So progress, not perfection.
Exactly. And celebrate those small wins along the way.
Yeah, that's a good point.
Speaking of which, what's one thing that stood out to you during this deep dive?
Let me think about that for a second.
Okay. It really makes you think about those little everyday choices.
It does, it does. So, what really stood out to me was that Finnish case study.
Oh, yeah, North Karelia.
Yeah. I
Huh.
mean, who would have thought that a place once famous for having, like, the worst heart health
Right.
could turn things around so drastically.
It's pretty amazing.
Yeah, it gives me hope that things can change.
Yeah, it shows we're not stuck with the status quo.
Exactly. It's not like we're doomed or anything.
Yeah, at all.
So it's proof that change is possible, but how? What are those actionable things? What did the sources suggest we actually do?
Well, one thing that kept popping up was this idea of collective action, like what they did in Finland. It wasn't just about individuals making changes. It was about the whole community coming together.
Got it. So like a systems approach.
Exactly. And, one of the articles you shared, it had this great quote: "The choices we make today, both big and small, ripple out and shape the world of tomorrow."
That's beautiful and so true.
Yeah, it really resonated with me.
This deep dive has really opened my eyes to how, my daily actions are part of something much bigger.
I think that's a key takeaway for all of us.
It is. It's not just about, eating my veggies, although that's important too.
Of course.
It's about realizing how interconnected everything is.
Yeah, it's like this web.
Our health, our communities, and the planet. They're all tangled up together.
Absolutely. And that can feel overwhelming sometimes.
It can.
But what I find most hopeful is that we don't have to be perfect. We just have to be willing to try.
That's a good point. It's about progress, not perfection, right?
Exactly.
Yeah.
And those small changes we make, they can have a ripple effect.
Yeah, like that teaspoon of salt example.
Exactly. It's those little things that add up over time.
So as we wrap up this deep dive into sustainable health, I guess we have a question for our listener.
Okay, shoot.
What's one small step you can take today to live a healthier, more sustainable life?
That's a great question.
Could be anything, really. Like swapping out a sugary drink for water, going for a walk in nature, maybe learning more about how our health is connected to the environment.
Love it.
Whatever it is, embrace the journey, right?
Yeah,
Every little step counts.
absolutely.
Until next time, stay curious and keep exploring. Let me think about that for a second.
Okay.
I think for me, it was that Finnish case study.
Oh, yeah.
Yeah, it really got me thinking.
It's a powerful example.
It is. It just shows that we're not stuck. Things can change even when it seems like we're up against these huge challenges.
Absolutely.
And it all comes back to those small changes, those everyday choices we were talking about.
Right. All of that.
Like that teaspoon of salt.
It's incredible, isn't it?
It really is.
Yeah.
It makes you realize that you don't have to climb a mountain to make a difference.
Exactly.
This whole deep dive has been a real eye-opener for me.
I'm glad to hear that.
It's not just about eating our veggies, though. That's part of it.
Of course.
It's about understanding how it's all connected.
Yeah, the interconnectedness of it all.
Our health, our communities, the planet.
It's a big web.
It is. It's a big web. And for me, the biggest takeaway is that
What is it?
the power of those small changes.
I agree.
We don't have to be perfect.
No, not at all.
We just have to try, right?
Exactly. Just be willing to make those small steps.
And those choices we make, they have this ripple effect.
We do.
They go way beyond just us.
It's true.
So listener, as we wrap up this deep dive into sustainable health, we have one question for you.
Okay.
What's one small step you can take today to live a healthier, more sustainable life?
What will it be?
It could be anything, really. Like maybe swap a sugary drink for water.
Yeah.
Go for a walk in nature.
That's a good one.
Or learn a bit more about how our health and the environment are connected.
Lots of options.
Whatever it is, embrace the journey.
Absolutely.
Every little bit counts, right?
It does. It does.
Until next time, stay curious and keep exploring.